So when this uterus is falling out, called uterine prolapse, there's a high chance that the woman will undergo a hysterectomy or the uterus will be removed. But now the debate has been, should you take the uterus out or should you leave the uterus in, called the uterine sparing procedure, something that I have been doing for over a decade. And we've published extensively on saving the uterus. And guess what? Uterus saving procedure or uterine sparing surgery or hysteropexy is gaining more prominence. But then again, who is the most important person to decide this? Is it me, who prefers to keep the uterus in? Or is it some other surgeon who prefers to take the uterus out? Or is it in fact the patient? We should ask her, right? She is the most important person. So they did. Women were asked and said, okay, if you were given a choice and told that, whether you take the uterus out or whether you leave the uterus in, right? The success is the same. There's no change, there's no increase or decrease in complications. So complications are the same, the success is the same, your recovery is the same, everything is the same, right? Whether you take the uterus out and do a hysterectomy or leave the uterus in and do a hysteropexy. If that is the case and everything was same, what would you prefer to do? So questions were posed to women. Over 60% of the women, so the majority of the women said, I would leave my uterus in. I don't want to take my uterus out. Especially once they realized that including the cost and all the other things that go with the hysterectomy, a large number would say that. Only a small percentage said that they would take the uterus out, and the middle one said, I'll leave it up to my doctor. So about like 25% said that I will, leave it up to my doctor, and about 10 or 15% said that, I would take it out. So clearly the majority would say leave the uterus back inside, and that is the woman. So we have to hear the sound and the voice of what she wants, not what I want, what she wants. And if she says that is what she wants, uterine sparing, that's exactly what she should say. And guess what? The evidence is in her favor. She's absolutely right.